Okay, I'm going to show you something that is crazy and sadly unbelievable, but it's the reality. So it came from this recent article that just came out on initiating oral or injectable naltrexone at discharge, equally effective for reducing heavy drinking and alcohol use disorder. Wait for it. So it says initiating oral or injectable naltrexone at hospital discharge significantly reduced heavy drinking in patients with alcohol use disorder. It is strange that despite its effectiveness, fewer than 2% of hospitalized patients with alcohol-related illnesses are offered medication. And sadly, this is not new information. These medications have been around for decades, but other papers online will say that despite good evidence supporting these treatments, less than 4% of people were prescribed a medication approved by the FDA for treating alcohol addiction. I have worked in this field since 2018. I use medication myself, naltrexone, starting in 2017 for alcohol addiction. And sadly, not much has changed in my experience with the willingness for physicians being willing to prescribe medication. In fact, I just talked to one of our members yesterday who went to a psychotherapist and a doctor, and both completely refused the medication, made the person feel terrible about their drinking, and essentially said, you need to go to a detox, then maybe we'll talk about prescribing a medication. This is just unbelievable because there are countless studies out there that show that naltrexone is really effective at helping people drink less alcohol. It helps to reduce cravings, yet the medical system just doesn't know about it. I've heard from doctors, therapists, pharmacists who tell me that they can't prescribe the medication or you can't drink on the medication. And I'm not a doctor, but I've dug into all the research. I personally use the medication myself, following the Sinclair method to reduce my drinking. It changed my life. I've worked in this field since 2018. I've seen it change the lives of thousands of other people, but the system just isn't caught up yet, sadly.